So we're going to dive into our guest portion today, and we've got Dr. Tia Robertson. She is the Health Director for Gaston County Public Health, and she'll be joining us today to go over some of your questions. So we've gathered a few of the questions that have been asked since we aired our first episode with Commissioner Bob Hovis and our Public Health Director, Steve Eaton. And we want to thank everybody for sending these in either via Facebook or by the COVID vaccine at gastongov.com email. So I'm going to start with a question from Amanda Memrick. She asks, how much COVID spread can we expect in local schools if everyone's wearing a face mask compared to having masks be optional? And I know that this was obviously a big debate before school started.
Correct. And it's a part of our prevention strategy for preventing the spread of COVID, and it's layered. Obviously, vaccination is number one, and then mask, 6 feet distance apart, and washing your hands. All of those mitigation efforts really help in decreasing the spread of COVID in general. So it will also help in decreasing the spread of COVID in schools. We've seen some really good reports of schools out in LA where they mandated universal mask wearing among their teachers as well as the students, and they've had small numbers of COVID-19 illnesses reported from that particular situation. We've had other schools where there wasn't a mask mandate and the numbers for COVID spread have skyrocketed in that area. So I think that just looking at that really basic data, you can see evidence that wearing a mask makes a difference, especially for our young children who are unable to be vaccinated.
Right.
The mask can be their only barrier against being infected with COVID-19. So in my experience, children tend to be okay with wearing a mask.
Sure.
Some of them think it's a costume.
Yeah, I've got a 6-year-old daughter, and she's got different ones and different patterns, and totally fine with it. And she'll remind us if we're going out the door to go somewhere. She's like, "Mom, Dad, do you have a mask?"
Right, there you go. So, I really encourage us to take every measure that we can to make sure our young ones are safe. And so wearing a mask for our children in school is definitely one step in the right direction that we need to take.
You talked a little bit about your experience, and before I get to the next question, I did want to talk a little bit about that. Can you tell us a little bit about your background, and then when the pandemic hit, like just some of the research that you do in terms of reading up on the vaccine and understanding some of the stuff that's going on?
Right, so, well, if we go back a couple of moons ago, before I went to medical school, I was actually in clinical research.
Oh, wow.
I was a clinical researcher for about 3 years.
Okay.
And I participated in coordinating studies for different phases of clinical trials, large ones, small ones, recruited patients for studies, followed up with data, had to report to the VAERS system, all those things. So I'm very much familiar with clinical trials and that process. When the pandemic hit and we started learning about COVID, SARS-CoV-2 virus, what is this? Immediately my clinical research skills just perked up, and I went right there, and I knew which articles to access to get credible information. I would go to peer-reviewed journals. So as a physician, we have several peer-reviewed journals for our specialty. I'm an obstetrician, gynecologist by training, and so I knew where to go to get information about women who are interested in their reproductive health related to the virus, women who are pregnant or breastfeeding. I knew the prime source to go for that. The American Medical Association has a peer-reviewed journal called JAMA. The New England Medical Journal is another reputable journal to use. So essentially, what I did was I honed in on my skills as a researcher and as a physician, and I was able to pull all these different articles from different places and read them for myself and make sense of it. And quite honestly, before I talked about anything related to the vaccine when it first came out, I read the FDA publication first to see what it's all about. I encourage anyone to read from reputable sources still, not just your your social media thread. And those can be fun to read. And I'll tell you, it's so easy for us to allow someone else to digest information for us. And then we just pick up the bits because someone else does the work and we just kind of read the Cliff Notes. Everyone knew about Cliff Notes in college, right? Or even
I don't
in
know
high
what you're
school,
talking about. Nobody used that.
Canterbury Tales, you didn't really want to read the whole thing, so you may have just picked up the Cliff Notes for it, right? So I kind of think about social media as kind of like the Cliff Note version, but that's someone else's interpretation. So you want to get your own interpretation. Go to the source. Find the data. If you're going to do the data research into data, you have to go to those actual journals where it was published and read the original papers for yourself.
Well, and they've done, kind of on that same topic, there's been a lot of research that's been done, and there's been extraordinary access provided to the clinical trials and to the data around that to provide as much transparency as possible into kind of the decision making that went into making sure that the EUAs were authorized, and then just kind of throughout this process, knowing how quickly this has come about.
Absolutely, and there's also a COVID task force that was put together, I believe, in January. And they have open public forums where you can watch their actual meetings and you can submit your questions and they'll get back to you. So the transparency is really good. You just have to go to the right sources. Don't let anyone else tell you what they believe. Read it for yourself.
That's great advice. We've got another question here, Elaine. And Elaine, I am sorry if I butcher your last name. I believe it's Parhamovich, and I probably just butchered that, so my apologies, Elaine. Of Gastonia, she emailed to tell us that she really appreciated the first episode of COVID Conversations, and wants to know, as government, as medical professionals, how do we convince people to get vaccinated and to wear masks when folks continue to believe false information that's being peddled on social media and through other sources? I mean, we were kind of just talking about some of this.
Right, we were talking about some of that too, and also just, sharing the stories. When you are disconnected and you don't know anyone that's been in the ICU, or you don't know anyone who's attended a funeral for someone who had COVID, you don't understand the impact it has on their lives, right? And so this concept of, don't spread COVID and do all these different things, you may feel like, no, I'm fine, so I don't have to do that. I don't know, I can't relate to these stories. But even if you can't relate to someone having had COVID and been hospitalized or died from COVID, let me ask you this question, Adam. You're married, right?
Yes.
Can I get a little personal with you?
Yeah, absolutely.
Okay, all right. You're married. If your wife spends all day cooking, and then she prepares this meal and a little burnt on the side, right? And it's like not as good as you thought it was supposed to be at all.
Right.
What do you do?
Well, I try not to stick my foot in my mouth. I usually try to be very complimentary, and usually if there's something where it's like, no, I totally overcooked this, and she'll admit it first and be like, yeah, it was a little overcooked. But I try to be as gracious as I can and appreciative of the fact that she spent that much time doing it, because I appreciate the effort that she's putting forward on that.
And you care about her.
Absolutely.
Right? And you want her to be happy.
Yeah.
I'm like, okay.
I don't really enjoy sleeping on the couch either, so there's that.
All right. If you have children,
yes.
Right? So if your child needed you, you would do whatever is needed to protect them.
100%.
110%, right?
Yep.
Absolutely. So say if someone has a spouse that's at high risk for having a stroke or a heart attack, right? They have really bad diabetes, in and out the hospital. What if they need an ICU bed? They need someone to staff that ICU bed, right?
Yep.
But guess what? You can't get one.
Yeah.
Why? Because people who are unvaccinated are in those beds. We're going to take care of everybody. And medicine is do no harm. We live by that. So we don't discriminate. We take care of everyone. But what if your loved one needed some help in the hospital and there were no resources available because they're all being utilized to treat patients with COVID? What you want to do, everything in your power to protect them?
Absolutely.
Get vaccinated.
Well, and the sad thing is it's not, maybe a month ago this would have been hypothetical, but it's not anymore. I mean, we're starting to see this play out in hospitals and cities all over the country, unfortunately.
Exactly. There are people all over the country who are dying, who wouldn't have died before the pandemic because the hospitals don't have the resources to take care of them.
And we get, we get questions about that from people when they look at, oh, well, when you're putting out the data on the number of people hospitalized, that's such a small percentage of, the total population that's sick or hospitalized. And it's like, why should I do something for such a small percentage? But it's, to your point, it's all hitting at once and it's filling up our hospitals. It's really taxing the frontline responders' ability to provide the needed service, not only for people that are going in that are hospitalized with COVID, but just with any other medical condition or any other medical emergency.
Exactly. There are only so many people that can work in the hospital and so much time to give. So if you don't want to get the vaccine for yourself, get it for the people you love.
Rowena Cathcart has put a question to us, and she says there's been personal statements on Facebook that the CDC has said that vaccines do not protect anyone from COVID-19 or any of this variants. Is this true?
We kind of already talked about this, Adam. Yep. Definitely a myth. This is not true. The vaccines, again, were created to prevent hospitalization, severe disease, and illness. And there's a greater than 90% effectiveness for all of the vaccines that are in use here in the United States. Can someone still be infected with a vaccine and develop a mild disease or become asymptomatic? Can someone still be infected with the virus?
Right.
And still develop a mild disease or be asymptomatic? Yes, you can. But those numbers are small compared to those who are unvaccinated.
Right.
Okay? So the vaccines are working for their intended use and are preventing the spread of COVID-19.
Chad Parnell weighs in on our Facebook page, and he says that the track record of Pfizer or other big pharmaceutical companies isn't great, so why should we trust them when it comes to this vaccine?
Well, I can tell you one thing. Pfizer makes a whole lot of things more than just this one vaccine. Mm-hmm. You have all types of medications that are made by Pfizer and several other big pharmaceutical companies. And if you trust them with those, why not trust them with this vaccine?
Kind of going back to something you had said earlier about kind of when you did the research initially and kind of throughout this pandemic, the stuff that's out there is being reviewed by independent virologists, physicians, people that know this stuff, that aren't tied to any of these pharmaceutical companies in any way, shape, or form.
Correct.
And so you're able to independently review the science and look at this and go, yes, this makes sense. What they're presenting makes sense, and I would recommend this for people that were my patients.
Exactly. And I go through that process with any medication that's offered to my patients, right? You go to those peer-reviewed journals to make sure that other like-minded people and experts in that field have reviewed the data and the research that had been performed to make sure it was done in an ethical manner, to make sure the integrity was there, make sure they had a good number of people to draw the conclusions that were drawn. Mm-hmm. There are a lot of studies where you only have like 10 or 20 people, right?
Right.
I like to call that a pilot study maybe, or maybe just a study to give us, okay, well that was, you can get information from a study with 10 or 20 people. You can say, okay, well let's build on that and get more people involved and see if we can replicate the same results or see what happens if we replicate the study. So they're, understanding how drugs are approved in this country and the data and the research and expertise that's required to understand that process gives people comfort, right? You trust your doctor because you know your doctor has your best interest in mind. You know, your doctor went to medical school and spent so many years in residency, and they've been treating with so many other patients, and
Yep.
they're all still doing okay. So you keep going back, right?
Mhm.
You feel fine, okay, I feel better. And you have to learn how, at some point in time, trust the experts. Trust the experts because they've been trained on how to process this information.
The last question that we have, and this is kind of the flip side of what Chad put out there, is Kenny Boyd weighed in on our Facebook page, and he says that, well, he doesn't trust government, so why would he get the shot?
Well, you know what? That's a great question. You know, you don't trust the government, so why get the shot? Wow, there are a lot of answers to that question. You don't have to trust the government to want to be healthy,
Right.
right? You can trust the government or you can not trust the government. But if you need to take blood pressure medication, you're still going to take it.
Yep.
You don't want to have a stroke.
Right.
If you need to take insulin for your blood sugars, you're still going to take it, right?
Yep.
Because you don't want to end up in a coma. If you don't want to end up in the ICU because you have COVID-19, then you can still get the vaccine. It's the same line of logic.
Absolutely. Well, I think some of that gets to kind of the work that we've been trying to do behind the scenes for months now, is trying to build a coalition of faith leaders, business leaders, physicians, people that have basically said, like, I absolutely believe in the vaccine and I want to advocate for it in the community, to show that it's not just, okay, it's, you know, government telling you to do it, whether it's, you know, the CDC or the Trump administration or the Biden administration or whoever. It's, you know, this is, like you said, it's peer-reviewed science from the experts. And, you know, I guess at some point, like, if you're not going to believe any of them, who are you going to believe?
Exactly.
Dr. Tia Robertson, we're going to bring you back for the last segment, talking a little bit about some myths. We got 3 myths for you to break down for us, and we will tackle that just ahead.
I wear a mask for my daughter.
We wear a mask for our family.
I wear a mask for my uncle who is battling cancer. It's going to take all of us masks together.
So we're going to wrap up our episode of COVID Conversations today with our myths section. And we've got Dr. Tia Robertson here. She's our medical director at Gaston County Public Health. She's been kind enough to join us. And Dr. Robertson, we've got 3 myths today that we're going to tackle. And the first one that we've heard from quite a few people is that the COVID vaccine changes your DNA.
Wow. All right. That is a myth for sure. The COVID vaccine does not change your DNA. In fact, it doesn't come anywhere near your DNA. The way that the mRNA vaccines work is that it codes for a spike protein that's on the coronavirus. So I think everyone's kind of seen that little picture of a COVID virus. It's a little sphere with...
Yeah, it's in my dreams now. It's never going to leave me alone.
Right. I think I have something at home that's like a chandelier that my sister has named the coronavirus ball.
Nice.
I can't use that anymore. So
Nice.
It has little spikes on it, right?
Mm-hmm.
And so those spikes, they're what bind to your cells.
Okay.
And provides the ability for the virus to fuse with your cell and infect it. And so what the vaccine does, the mRNA vaccine, it actually codes for one of those spike proteins.
Okay.
But it's a harmless portion of the spike protein that it codes for. And it just gives your body the information to create this protein. And then once your body creates it, it presents it on the cell. And then that presentation of the protein on the cell, that's very similar to what the virus is, but it's a harmless portion of it, that's what causes your immune system to respond. And then when your immune system responds to this, if you want to call it fake protein,
Right.
once it responds to that, then your body creates the memory. And that way, if COVID ever enters your body, you can fight it off because your body has now built the immune system to work against it.
That's
and you didn't have to
fascinating.
get you did not end up getting COVID. And it did not enter your nucleus, which is where your DNA is.
Interesting. I mean, as much information as I've learned about COVID over the last 18 months, I never had that good of an explanation of kind of what exactly the mRNA vaccine does. So that's actually really helpful.
Thank you.
The second myth, the COVID vaccine is responsible for thousands of deaths, and people point to the VAERS website where this is kind of coming from. They're saying more than 6,000 deaths have been reported since last December from people that took the vaccine. So it's, I guess, also a myth, right?
Right, definitely a myth. But you know what? That can be really confusing. I had to reread it a couple of times myself, to make sure I understood what was actually being communicated.
Right.
And basically what it is, VAERS stands for Vaccine Adverse Event Reporting System,
Okay.
right? So the public health officials encourage healthcare professionals, vaccine manufacturers, and the general public to use this system appropriately, because we are monitoring anything that happens after people take the vaccine. We've been monitoring this since the first week we've been doing vaccinations.
Right.
And because of this monitoring system, practically anyone can report any adverse event after receiving the vaccine. Now, if someone reports a death after receiving the vaccine, the VAERS report does not confirm that that death was related to the actual vaccine. It's just that it happened. So then there has to be another layer of investigation to figure out what actually happened, if there was a true relationship between getting the vaccine and the death that occurred. So the CDC has reviewed the clinical information that's available. If there was an autopsy, that's reviewed. Medical records, that was reviewed. Any lab work that was available, all those things have been reviewed. And to date, very, very few have been related to the actual vaccine.
Right.
So I'm sure many of you have heard about the Johnson & Johnson vaccine, and that there were 1 in a million people who actually developed blood clots, and some of them actually did die. But that number was so small, meaning single-digit numbers, that it's not significant enough to say that the vaccine is dangerous.
Right.
We know that this vaccine, all of the vaccines that have been given FDA approval or emergency use authorization, are safe and effective.
Well, I feel like I was watching some football on TV this weekend, and it struck me because there was a commercial for one of millions of different prescription medications, where it's like, ask your doctor about this, and then like they're legally required to sit there and tell you, like, a small number of people that took part in the trial may have developed X, Y, and Z, and then they run through this list of like 47 different things that like you could potentially get. And it seems like that's the case with almost any drug, because it's not going to affect everybody the same way. Like, everybody's bodies are a little bit different, and so there's, even after they've tested them, there's always going to be this very, 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 very small percentage of people that could have a adverse reaction.
Exactly.
All right, so the third myth, and we've been hearing this a little bit more lately as well. Obviously, we're talking a lot about whether or not there's going to be a booster shot and when that's going to be rolled out. So some people are saying, well, the fact that you need a booster shot proves that the vaccines aren't effective.
Right. And some people are also people in my own family who have said that to me, cousins. And I say to them, well, you know what? The vaccines are doing exactly what they were approved to do. They are preventing severe illness from COVID-19, they are preventing hospitalization, and they are preventing death. Currently, across the entire United States, at least 95%, and some upwards of 99%, of the people who are hospitalized are unvaccinated. So that's objective data to clearly explain that vaccines work. Boosters are not new to the world of vaccines. You have children who get the booster for measles or mumps or any other vaccination that they get. They have a schedule, and they have to get the booster every so years, right?
Sure.
Because your body, over time, with some vaccines, the protection just naturally declines. And when that occurs, you need a booster.
Right.
So the COVID vaccine is no different from any other vaccine that may need a booster in the future. There are a few reasons why you may need a booster. And one would be if the immune system isn't as well protected anymore,
Right.
one. The other is, in this pandemic, if we have another variant that's stronger or more transmissible than what the original vaccines were designed to protect us from, then we'll need a new booster in order to protect ourselves from that variant, right?
Yep.
So I don't want anyone to be afraid of the idea of having to get a booster. Variants occur naturally. The flu is way more variable than the SARS-CoV-2 virus.
Right.
And for that reason, we get a fairly different type of vaccine for the flu every year. So the need to modify vaccines or add boosters to vaccines, that's pretty consistent with history and what we've been doing in medical science for the last several decades. This isn't a new concept. It's just how we're able to continue to protect ourselves against the current state that we live in.
Awesome. Dr. Tia Robertson, our medical expert for this week's COVID Conversations, thank you so much for joining us.
Thank you for having me.
Now we have a few metrics updates for you from last week. Our average daily case count was 157 cases a day. This is down slightly from the week before, where we had an average of 190 cases each day. Our hospitalizations have stabilized over the past week, with an average of 128 individuals hospitalized each day. We did have 8 additional deaths last week. We are seeing a higher percentage of younger people hospitalized, and our pediatric cases continue to rise. Even though our schools have done a great job helping prevent the spread within the schools, a reminder for parents in our community that children who are taking part in activities after school or with their youth groups or through other sports still need to practice masking and social distancing. Please be sure to check out GastonSaves.com for these updates and more.